Hello, welcome to our channel. Today we will discuss about Alzheimer's disease. This disease is named after Dr. Alois Alzheimer. In 1906, Dr. Alzheimer noticed that changes in the brain tissue of a woman who had died of an unusual mental illness. So it is a progressive disease that destroys the memory and other important mental functions. The incidence. The prevalence worldwide is estimated to be as high as 24 million. In India, greater than 4 million people are estimated to be suffering from Alzheimer's disease and other forms of dementia. So, to define Alzheimer's disease, it is a neurodegenerative disease, chronic disease that slowly destroys the memory, thinking, skills, and eventually the ability of the patient to carry the simplest task of their life. So, it is a chronic neurodegenerative disease of the brain where it destroys the ability to remember things, to think, and to eventually they are not able to carry out the simplest task. Dementia. So there is always a confusion exists between the Alzheimer's disease and the dementia. Dementia is a group of condition where multiple impairment will be there in the patient. Two brain function impairment will be there such as memory loss and judgment. And Alzheimer's disease is the leading cause for dementia. Anatomy and physiology regarding our brain. We know that the healthy human brain contains billions of neurons. It transits information via electrical and the chemical signals. To the information is transmitted through the electrical and the chemical signals. So they send messages to different parts of the brain and other parts. So it is very normal that as aging increases, the brain shrinks to some degree, which is very natural. There is no problem in that. But in the case of Alzheimer's disease, as the picture itself indicates, you can see how a healthy brain look and how the Alzheimer patient's brain looks like. There is immense or reasonable shrinkage of the brain, and the shrinkage of the brain cell will show an enlarged ventricles. So here the damage is widespread. The neurons will stop function. They are not transmitting the messages or the communication is not taking properly. The disruption will be on a larger area. The main area is affected the hippocampus, which is responsible for the memory, and again it will spread to the frontal area, other parts of the brain. The communication is affected, metabolism is affected, thinking and repair, all these are affected. Over time, the loss of ability to live and function independently results in the patient. Risk factors. What are the causes of risk and risk factors for Alzheimer's disease? There is always a risk, age risk. Over 65 years, the chance of occurrence is double the rate. Familial history, if a parent has, then the next generation probability of occurrence is on the higher side. Genetics, some genes are also responsible. And other modifiable risk factors such as cardiovascular diseases, hypertension, obesity, lack of physical exercise, all these are there. So as I said earlier, age over 65 years, apolipoprotein E gene, particularly the APOE4 variant, this has a central role for occurring the Alzheimer's disease. Other three genes is the amyloid precursor protein, presenilin 1 and presenilin 2. Any mutation in any of these genes can also result in the chances of Alzheimer's disease. Other risk factors include cardiovascular diseases, hypertension, obesity, lack of physical exercises, alcohol, smoking, drugs, low mental engagement, poor diet, poor sleep, untreated depression. So there will always be a question how all these things contribute to the occurrence of Alzheimer's disease, because we know that in cardiovascular diseases, hypertension, alcohol, smoking, in all these, the vascular system is affected. Proper blood supply, oxygen delivery, nutrients are not delivered into the brain cells, so that will lead to impairment, cell functioning, cell death, neurodegenerative changes happens, cognitive domain is affected and leads to a state of Alzheimer's disease. So pathophysiology. This is very complex. There are some theses or hypotheses behind the Alzheimer's disease pathophysiology. Like one hypothesis about the cholinergic reduction, oxidative stress, hyperphosphorylated top protein hypothesis, beta amyloid hypothesis, metal ion hypothesis. Now let's see how and what is this hypothesis actually. Amyloid hypothesis, there is beta amyloid proteins are there. So this amyloid beta peptides aggregation, excessive accumulation of this amyloid beta peptides in the brain uh, causes a plaque. You know, they are getting accumulated together, they stick together and it forms a shape of plaques. So that will trigger the neuroinflammation and this neuroinflammation will cause a stress, oxidative stress inside the brain. Oxidative stress leads to poor cell function, impaired cell function, and cell damage. Neurons are affected, and the transmit of energy or the communication or the signal between the neurons is also affects. So this cascades eventually result in the neuronal death and the cognitive decline characteristics of Alzheimer's disease. Now, tau protein hypothesis. Tau is a protein. It's a vital protein. You know, there is neurons are there. In neurons, in a healthy neuron, there is microtubules are there. So the proper functioning of the neuron, the nerve cell, this microtubules helps. So this acts as a cellular highway for the transport of the nutrients and other molecules. So this tau get hyperphosphorylation happens due to the enzyme reaction and abnormal changes occurs within this tau protein that causes changes in these microtubules. So they get clumped up. Neurofibrillary tangles are formed along the nerves, the neurons. So the highway is affected. So cellular highway is affected. They can't properly transport the nutrients and other molecules between the neurons. So that also goes to the stress and it results in the characteristic features of the Alzheimer's disease. Because neuroinflammation happens, neurodegeneration occurs properly, the nutrients are not delivered due to this protein, abnormal change in the tau protein. And oxidative stress. It is a caused. Oxidative stress is caused by an imbalance between free radicals and antioxidants in the body. So antioxidants are the substance that helps in the proper cell functioning and maintenance. So when this antioxidants lessen and the free radicals get increased, there is an imbalance happens between these two. So that will causes a a situation where stress happens. Free radicals are oxygen containing molecules with an uneven number of electrons. So they can react easily with other molecules and cause oxidation. So this oxidative stress occurs and it leads to the cell and the tissue damage. So the proper oxygen, proper nutrients are not delivered, cell can't function properly, tissue necrosis happens and then eventually the brain shrinkage occurs. So that is the characteristic features of the Alzheimer's disease. Metal ion. There are ions in our body such as iron, copper and zinc. It has an important role in the maintenance of the brain function but it should be in a trace. It should be in a level. So the excess accumulation of these ions or the beta amyloid protein or the tau hyperphosphorylated protein so that will affect the neurodegenerative changes results. Now, early signs. There are some early signs. This is a chronic process. When this neurofibrillary triangles formation occurs, or when the amyloid plaques starts to appear, all of a sudden the symptoms are not shown. It will take a long period of time to show the symptoms. Once, it's a long process. Amyloid plaques are formed, neurofibrillary tangles are formed, and the proper transport of the nutrients, oxygen, cellular pathways are affected, neurons are dysfunctioned. So eventually, when all this happens, eventually they show the symptoms. The first symptom is the memory loss that disrupts the daily life, forgetting recently. So they can't remember what they just told, what they just had, what they just learned. So the recent memory is affected, and they can't find where they have kept their things. They can't retrace where they have kept their things, and they can't carry out the normal familiar task to drive a car to their familiar location. Sometimes they will forget, yeah, this is the place where I'm living. They will go further because they don't know where they are living, so they forget that. They forget the name of their beloved ones. So challenges in planning or solving, they can't solve problem. There is no good judgment about them. Like, I have to get up, I have to take a bath, and I have to do like this. They don't have that judgment, and they're confused about the time, about the place, about the people, and they can't understand what is happening. They have spatial relation problem, visual changes, visual images, and also when they are having a conversation and at the middle of the conversation they forget. They don't know how to end that, how to carry that conversation. They have no idea what they were talking. They will repeat the words themselves and misplacing things and losing the ability to retrace and decrease your poor judgment, as I said. Withdrawal. They are not interested in social activities. Once they were interested in doing games, to do tennis or to cricket, now they don't have any interest in playing all those activities. They are withdrawn from the community or the environment, and there will be more changes. They can't handle situation. They will become confused, depressed, anxious, suspicious. They are easily upset at home with friends, or sometimes when they are out of their comfort zone, they are very much distracted. So these are the symptoms or the early signs that we notice in the Alzheimer's disease. Stages of Alzheimer's disease, there is, early stage, middle stage, late stage. According to symptoms that is showing, we can categorize into early stage, middle stage, and the late stage. In early stage, the symptoms will be like the general forgetfulness. That will not be that evident that this is a patient of Alzheimer's disease. They will forget recently read material. They can't organize things. They can't plan things. They don't know where they have kept their valuable things. They have trouble in managing money, how to utilize the money or how to spend the money, and they forget recent events, trouble with challenging tasks at work. So, and they will drive to some other place rather than their home. So, these are the early symptoms in Alzheimer's disease. When we come to middle symptoms, they will be having delusions, compulsions, repetitive behavior. It is more psychological now, agitative, restlessness, anxiety. They need like assistance to get rest. They have bladder involvement, bowel involvement. They have trouble learning new things, and problems with reading and writing. They lost track of time and surroundings. They have sleep disturbance, lack of sleep, and in late symptoms, significant personality and behavior change. They are not able to hold conversation. They will be mute. They can't move. They can't eat. They can't swallow. They can't do things. They are really dependent on others. They have lack of awareness on everything. They have no control over their bladder and bowel, and they have a highly susceptibility thinking of their infections like pneumonia. So they are very susceptible to infections like pneumonia because there is chances of getting aspirated because they have difficulty in swallowing. So probably there is probability of aspiration, so that will lead to pneumonia type problem, serious health condition. So these are the stages of the Alzheimer's disease. Diagnostic evaluation. We can ask the person how they're experiencing, or we can ask the family member about like how their health is, how they are carrying out, how their medication, how their diet. What are the other medical problems they have there? Is there any risk factors associated for the diagnosis of that is leading to the Alzheimer's disease? And how their behavior, whether they have any memory problem, whether they have any swallowing problem or eating problem, mood problem, irritatedness, or whether they just doze off, they don't know where they are going or what is the time now, who all are with them. So all these can be get all this information we can acquire from the bystander or the family member. Administer a psychiatric evaluation to determine if it is associated with depression or any other mental health condition, because sometimes the mutism, or they can't talk properly, they can't have a judgment or solve the problem. Or this can be due to psychological issues. So that should be evaluated whether it is due to that or not. Conduct tests. There is cognitive tests which which evaluate their memory, attention, speaking, counting, language, problem solving. So mini mental status examinations are there. So that should be carried out. And blood test, urine test to find out the presence of the protein. And scans are there, CTs are there, because that will show the shrinkage. When there is an evident shrinkage, that is understood that the patient has some neurodegenerative problem in their brain. And when we do a neurological examination, we can check the reflexes, their coordination, their movement, their muscle tone, their strength, their ability to get up, their power, their know how, if they can, if there is assistance needed, their sight, their hearing, their coordination, balance, all this can be done. And during a PET scan, a low level radioactive tracer is injected into the blood to reveal a particular feature in the brain. So the PET include fluorodeoxyglucose, amyloid PET imagings are there, tau PET imagings are there, blood test for plasma amyloid betas are there. Detailed diagnosis can be done by the geriatrics. They are specialized in patient over 60 years. Geriatric psychiatrists are there, neurologists, neuropsychologists are there in order to determine about their memory and thinking. Now, the management, how we can manage Alzheimer's disease. There is no pure cure for the Alzheimer's disease, because once the brain damaged, the shrinkage, it is permanent. We can't do anything for that, but we can control the symptoms, and we can help the patient deal with it. We can reduce the change or the degeneration that is happening inside the brain. There is cholinesterase inhibitor. As I said earlier about the cholinergic reduction, the cholinesterase are some of the enzymes that breaks down the acetylcholine, which is a neurotransmitter, helps in the proper functioning of the brain cells. So this cholinesterase inhibitors will prevent the acetylcholine from getting breaking down, and they will maintain the level of the acetylcholine neurotransmitter inside the brain, so that the change or the destruction can be minimized. So these drugs work by boosting the level of the cell-to-cell communication by preserving this chemical messenger, the acetylcholine, which is depleted in the brain, especially in the Alzheimer's disease. The drugs include like donepezil, galantamine, rivastigmine are given to the patient, and it has side effects such as heart problems, arrhythmias, diarrhea, gastric problems, and sleep-related problems. So the next drug is the NMDA receptor antagonist. So NMDA is the N-methyl D-aspartate. So N-methyl D-aspartate is a receptor which is responsible for the binding with glutamate, and it process the synaptic elasticity, learning, and memory. But in Alzheimer's disease, this antagonists are given so that it will inhibit the action of the N-methyl D-aspartate receptor. In dementia or in Alzheimer's, this is to treat moderate to severe dementia. It will slow the progression of symptoms by protecting the neurons from glutamate toxicity. So, glutamate toxicity cannot be handled because that will cause an oxidative stress, cellular damage, and cell death, which leads to Alzheimer's disease. So, this memantine is given, and it is a N-methyl D-aspartate receptor agonist, and it is given in combination with cholinesterase. And a safe and supportive environment. Always keep keys, wallets, mobile phones, and other valuables in the same place at home so they don't become lost, because it should be in a place where they can seen by them. And also medication should be in a secure location. Always maintain a checklist so that we can keep a track on dosages and the time, the frequency, whether it is taken or not. And also we have to arrange for finances, because they can't do the finance by themselves. They don't have the proper problem solving or the judgment ability. And mobile phone with location with programmed phone number, install alarm sensors. Regular appointments, always calendar or whiteboard in the home to track daily schedules, install sturdy handrails because dizziness related to the side effects of the drugs and coordination problem, balance problem is there in the later stages of the Alzheimer's disease. So we have to arrange a handrails or the support so that the chances of getting falls can be prevented. Shoes and slippers should be of comfortable ones. Good grip should be there, and we should reduce the number of them because they are already confused. Seeing so many mirrors around them, it will create more confusion. And always make them to wear a medical alert so that in the middle of a crowd, if they get lost, a medical alert bracelet or an identification card will help them to be at a safe place. We can bring the people can bring them back to the home. Keep photographs and other meaningful objects. Lifestyle and home remedies, exercises, nutrition, proper healthy food, water, healthy beverages, high calorie, healthy shakes and smoothies, social engagement and activities. To conclude, AD is the most common of many causes of dementia and its prevalence is increasing worldwide. Disease pathology starts years before noticeable symptoms. As I said earlier, it is not happening all of a sudden. It will take time. The neurodegeneration, the changes inside the brain, the shrinkage of the brain tissues takes time due to the neurofibrillary tangles and the accumulation of the beta amyloid protein. So it will take time. Neuropsychological imaging and spinal fluid tests can establish the diagnosis with high accuracy. So this is not a very simple disease. It is a very dangerous disease. So hope that you have got some idea regarding the Alzheimer's disease. See you soon with another video. If you like my video, please like, subscribe and share. Thank you.